What's your name?
Cassandra Roberts.
My name is John Andrews.
My name is Susan Spears.
My name is Mikhail.
And when were you diagnosed with HIV?
1993.
In 1994.
In December of 1990.
I was diagnosed in 1995.
And they determined that at that time I had full-blown AIDS or advanced HIV disease. So they figured that I probably had HIV for about 10 years before I actually tested positive. So they think I had it as early as 1984.
Because I got a rash, and it turned out to be chickenpox.
Prior to that, my husband had been diagnosed with AIDS. He was in the hospital when he told me he had AIDS. And so I had already been dealing with that for about a week till I got my diagnosis.
The doctor, and he said, well, you should get tested, and so I did, and when it came back positive, my husband, was very, very distraught, and I just, first thing came to mind is how do I take care of this?
Did you know anything about HIV or AIDS before you were diagnosed with it?
Not really.
I knew a little bit.
No.
I knew it existed, I just didn't think I would ever have to know anything about it.
One of my best friends from college had HIV.
The only thing I knew about HIV was I kept reading in the newspaper about Ryan White, and all what stuff he went through.
It was around 1979, and a friend called me from San Jose saying, did you hear about this new gay cancer stuff?
And I was helping take care of him.
And that was about it. I didn't really know a lot, but...
And you realized it wasn't because you were gay, you realized it was because it's transferable in any...
It's transferable from anybody.
He died a really horrible death. So my experience with HIV was this is really a horrible thing. If you get it, you'll die. So of course I was so terrified of getting tested.
And how did you feel when you found out that you had it?
Like I wasn't special.
When the doctor sits down with you and says you have HIV, it's like time stops.
Well, I was more devastated about my husband.
Actually, for me, I don't think I was surprised.
It's like you're hit by a lightning bolt, your heartbeat just stops. And that heartbeat, your life changes forever.
I had 2 kids, and they were only 2 and 4 at the time. And that was really what I was worried more about.
I guess I just took it kind of very calmly.
The doctor said, you know what, you will be dead in 12 to 18 months. You need to get your affairs in order. So I wrote my will and planned my funeral, and I sort of made a trip around the country saying goodbye to the people I loved. It was really surreal.
But like I said, when I got my diagnosis, it was like a relief that the boys were okay. And I just thought, well, this is our path. We're going to take care of each other.
Because my husband cried and I didn't. I was just like, okay, so now let's take this show on the road and handle this.
And what kind of things do you have to do now to keep your immune system as healthy as possible?
I take 1 pill a day.
Wow, everything possible. I do all the right things that we all should do all the time. So I try and eat well, I exercise, get lots of rest. I try and minimize the stress in my life.
I'm fortunate. I've hardly had any illnesses.
I try not to be around people who have colds or...
But I also have to take a lot of drugs, a lot of medicine.
And that's all I do. I'm undetectable now.
So because I've had HIV for such a long time, I actually have different strains of the virus, different mutations of the virus in my body. So different drugs are more effective on different strains than others.
I take 3 medicines. I take them once a day, at the same time of the day.
Because the slightest thing can set you off.
One of which is a drug I have to be injected with.
I just take my medicine every day. I try to keep stress levels down and try to keep a positive attitude.
Drink lots of fluids, lots and lots of fluids, because the medications will dry you out.
And then I have to take a bunch of drugs because the HIV drugs cause side effects, really unpleasant side effects in some cases.
I have like 1,500 T cells, which is crazy.
When I started, I must have been taking like 20 medications.
All told, all of these drugs cost about $170,000.
Wow.
every year just to keep me alive.
This is going on 20-something years, so I'm really fortunate.
I'm down to 1 now.
Wow.
That's great.
That's great.
You know, and, you know, but of course you have to take care of yourself. You exercise, I take many vitamins, you know, and I try to eat properly.
And how could you have prevented HIV if you could go back in time?
When I went back in a relationship that I left. Really, that's how I got it.
Had I known, I probably would have become a nun.
That's the only thing I would have did different. But I don't regret anything I did.
Well, I believe that I got it through sexual behavior. So I probably didn't get it through, I wasn't an intravenous drug user, so I didn't get it probably through a needle stick.
Truth be told, I don't know, you know, it's like I can't go back and say I would have done something different.
And, you know, sometimes I think about who could I have gotten it from, but you know what, it really doesn't matter.
If I hadn't have got HIV, I probably would still be having a destructive path.
But all I can do is give hope for future generations by letting them know what I'm going through now.
And what do you think young people should do now to prevent it?
Don't let nobody talk you out of not putting on a condom. Always wear a condom.
I would say get to know your partner pretty well before you have sex.
You know, if somebody wants you to have sex with them, say no.
Because it's still out there. I mean, it's like, don't ever take a chance with your life. It's too valuable.
Get tested, use protection.
You have to protect yourself.
And because when you found out you were HIV positive, now are you more appreciative and you realize how valuable your life is? And
Oh, for sure.
Yeah, well, it's completely changed my life.
Oh, definitely, most definitely.
I think that HIV was this huge wake-up call.
Actually, HIV made my life more positive. I mean, I have a different outlook on it anyway.
I'm very thankful.
And even though I've been living a long time with this disease, I am reminded every day to do that, to live intentionally, to love the people I love, to
That's great.
do what I think is important in life.
If something bad happens to you, you can deny it, you can let it define you, but you can also let it strengthen you and make you stronger. And I think that's what I've done.
And enjoy life, because you know what? Life is so precious. We never know how long we have. And we just got to grab for every second of happiness we can, because, you know, life today, right now, this moment is a gift to me, because, you know, none of us know how much time we have.